These are my grandparents, Jack and Marie Harper. These two have been my world my whole life. My father's parents died before I was born, so they are the only grandparents I've ever known. Until I was 12, I lived less than 15 minutes away from them, and we attended the same church, so I saw them all the time. They were at every birthday party, concert, recital, or major event I had until we moved to North Carolina in 2004. Growing up, I thought they were perfect, but as I have grown, my perceptions have changed. I've come to understand that the way they act and the way they handle the aging process is affected by multiple factors. I've learned to take an intersectional approach to their situation in an attempt to understand them better. The factors I will be considering in this video are their backgrounds, region of birth, age, religious beliefs, and level of education. Grandpa was born in Omaha, Nebraska in 1926. He's an only child with the personality to match it. He loves to be the center of attention and achieves this through being spunky and outrageous. Grandma was born in Fort Valley, Virginia in 1928. She is the oldest of 4 children and grew up on a farm. She is a soft-spoken, kind-hearted Southern woman with a hint of sass who doesn't take crap from anyone. These differing backgrounds have shaped their personalities, which shape their interactions with each other and their healthcare providers. Since Grandpa is an only child, he longs for attention, while Grandma is content to sit quietly in the background. This also makes Grandpa think he knows more than the doctors because he doesn't want to hear anything that makes him uncomfortable. He only wants to hear what he wants to hear. The region my grandparents were born in is important as well because it influenced how they viewed themselves and their role in society. Growing up in a small town in the South taught my grandmother that she needed to be a quiet housewife. On the other hand, growing up in a big city in the Midwest taught my grandfather to be ambitious. My grandparents also grew up in an entirely different era from me. They grew up learning that the man was the provider and the head of the household. This is why my grandma allows my grandfather to speak on her behalf. This becomes a problem at the doctor's office because Grandpa cannot accurately express how Grandma feels. And sometimes, Grandpa doesn't tell the doctor all of Grandma's symptoms to make them appear healthier than they are. My grandfather refuses to lose his manhood, so he won't admit that either of them truly need help. I also come from a very conservative Christian home. My grandfather was an elder at our church for many years. Christianity places a great emphasis on respect for elders, which means my family places a great emphasis as well. Society as a whole idolizes doctors, but my grandparents, especially my grandfather, doesn't see it that way. In their minds, doctors should be showing them respect because they are their elders. This mindset causes my grandpa to get short with doctors because he doesn't respect the knowledge that they have. The final factor I want to discuss is education. My grandmother attended Bob Jones University for a year. Bob Jones is still a very conservative school, but it was extreme in the 1940s. My grandma always tells stories about having to sign in and out of campus, daily dorm checks, and the dating parlor where all dates were supervised by staff members. She got sick during her freshman year and never returned. At the time, this wasn't a big deal because she planned to get married and become a housewife anyway. My grandfather, on the other hand, attended Omaha University, which is now known as the University of Nebraska at Omaha. The GI Bill paid for his education after he was drafted in World War II. His education gives him more social capital and control over my grandmother because it allowed him to be the sole provider for the family. It is also how they still survive because they're living off of Social Security and retirement checks that they received from my grandfather's previous employer, General Electric. As I've gotten older, I've started to see my grandparents through a sociological lens. It used to really bother me because all I focused on was how backwards I thought they were. From my grandpa speaking for my grandma, the clear gender roles within their household and the pressure that put on me and my sister to be domestic, to the way my grandfather always needed to be the center of attention. But once I started thinking about why all of this was happening, I began to see that all of the factors I've already mentioned have shaped them into who they are, so they are now acting out of who they were socialized to be. I think this intersectional approach of viewing a situation needs to be more prevalent in the medical field, especially when dealing with senior citizens. The interactions that occur between patient and healthcare professional are especially dependent upon these factors because they are the only way to truly understand geriatric patients. Without an understanding of these factors, my grandparents would appear to be a lost cause to doctors. In fact, 2 doctors have refused to continue treating my grandfather because he was too difficult. I have to wonder if those doctors would have taken the time to truly understand my grandfather, would they have cast him aside so quickly? Will they have tried a different approach to his treatment? My prediction is probably not, because of how the healthcare system is currently set up. It isn't efficient or cost-effective to keep treating my stubborn grandfather. An intersectional approach to medicine isn't the easiest approach, but it's what's best for the patients. I must admit I'm making this video with a heavy heart because I don't have much time left with my grandparents. My grandfather is dying quickly of congestive heart failure, and my grandmother is slowly slipping away from dementia. The good thing, though, is that I still have some time left with them, and the time I do have left will be much happier because I will think about these societal factors when I find myself getting frustrated with them. I can't slow down time to keep them with me longer, but I can enjoy the time I have left with them.